Hello, it's Dr. Rhonda Johnson. Today's Tuesday, June 14th, 2022. And today I'm doing an update on COVID wastewater surveillance monitoring. Now, why am I talking about wastewater surveillance monitoring? Because it's very important as a public health tool for this COVID pandemic. But first, we know that COVID-19 infection data is less and less reliable thanks to home testing and the fact that people just aren't getting PCR tests for a number of reasons. Well, remember that wastewater is an effective way to monitor case counts in the community. To refresh your memory about wastewater, recall the COVID viruses actively replicate in the gastrointestinal cells, and almost half of infected people shed COVID virus through their stool. Now, shedding of the live COVID virus in the stool can occur before the onset of symptoms and persist for several weeks, if not months, after symptomatic COVID infection has resolved. So wastewater testing is like an early warning system. It can detect the virus 1 to 2 weeks before cases start to surge in a community. One wastewater sample represents the infections of hundreds, thousands, or even millions of residents. So it's been about 18 months since the CDC launched the National Wastewater Surveillance System. The CDC website as of yesterday says they have over 900 sites reporting in. Now, they have a tool where you can check the wastewater levels in your community, and I'm one of these people that check them. And I checked not only my county, but my surrounding counties yesterday. And folks, the wastewater line is going up just like this, exponential, which means there's a whole lot of COVID in the communities where I live. So how is this system working? Well, there was a recent survey by Rockefeller and Mathematica Foundations, which shed some light. They surveyed health department and public health officers serving rural and urban communities across the United States. They got a decent response rate too. So some of the survey's findings showed that in spite of this rapid growth in wastewater monitoring over the past 2 years, some public health departments still lack capacity to do this, and others struggle with how to interpret and use the data for pandemic management. That's what it's supposed to do, folks. You know, sustainable funding emerged as a major concern in this survey because wastewater surveillance activities are predominantly funded through COVID-19 federal relief funds. And we know these funds are in serious jeopardy by Congress. So the bottom line, folks, of what I'm talking about today, this is just not good news. Wastewater surveillance is not only helpful for COVID, but it can be used to monitor other infectious diseases and threats such as substance abuse. It's a very important public health tool. It doesn't require people to have the means or the will to get tested. It just comes out in the water, yielding a more objective measure of COVID-19 levels in a community than case counts right now. We can't afford to have the system fail. For it to work, it requires funding, folks. It requires the funding to support implementation, staff training. Takes time to develop staff expertise to perform the tests and interpret the data. You have to have working relationships between wastewater utility treatment plants and public health departments, a lab. You have to have someone that can put the data together, report the data, analyze the data, and communicate the data. So we've already seen the damage done by a weakened public health infrastructure during this COVID pandemic. In my opinion, this survey clearly showed that not all communities are equally benefiting from innovative ways to monitor COVID pandemics in their community. And this is just unacceptable. That's my message today. As always, my views are my own. Stay safe out there. Check your wastewater levels in your community by going to the CDC National Wastewater Surveillance site. You can Google it and it'll take you right there. That's my message. Take care.